First of all, a big welcome to the many health professionals, social service staffs and other experts from across Fiji who are here today. And I'm sure you'll enjoy our Fijian hospitality. I'd also like to extend a special welcome to our many international guests. I'm informed that we are joined here today by friends and colleagues from Australia, New Zealand, India, South Africa, and of course our neighboring Pacific Island countries. We are honored to be host to such a diverse and eminent group, all of whom are united by the goals of building networks, sharing knowledge and experiences, and developing skills, and with the ultimate aim to ensuring safe, better, and more effective care for those in our communities who experience mental illness. Of course, that aim is captured well in the theme of your conference, strengthening mental health capacity in the Pacific. Ladies and gentlemen, Fiji is fortunate in that we currently have a sound legislative basis for our mental health services in the form of Mental Health Act. That Act sets out a range of principles of care, treatment and support of people with mental illness. It also confirms Fiji's adherence to international agreements and standards concerning the care and treatment of people with mental illness, as well as signaling a commitment, subject to available resources, to provide access to basic mental health care for all who need it, and to do so in the least restrictive way. Our main mental health facility is St. Giles Hospital here in Suva, which offers inpatient and outpatient care, as well as being the main center for training at both undergraduate and postgraduate levels. The Ministry of Health and Medical Services, ladies and gentlemen, is also actively engaged in the delivery of community-based mental health. There are community mental health teams in each of our 4 divisions, and we have also sought to integrate mental health into the broader concept of wellness that underpins our work to tackle the growing burden of NCDs. Of course, we could not accomplish what we do as a nation without the support of a whole wide range of NGOs, faith-based organizations and civil society partners which are engaged across the spectrum of advocacy, prevention and support services. I must also acknowledge the contributions of many multilateral and bilateral development partners who contribute so generously to our work. Ladies and gentlemen, I'm sure that much of what I have described resonates with the situation in other countries that are represented here. We may differ in the levels of resources we have at our disposal. Nevertheless, the challenges we face are similar, and the aspirations we all have to offer better lives for those experiencing mental illness are what unites us. That is why these exchanges that will take place here over the next few days are so important and valuable. You may also be aware that I have now been in my current role as a Minister for Health and Medical Services for almost a year, which this month marks 1 year. And as mentioned, I have served as a Minister for Women, Children and Poverty Alleviation. In my former role, I was confronted regularly with the realities of domestic violence in our society. In my current role, I also had the privilege of representing Fiji at a recent meeting of Commonwealth Health Ministers. And I was again concerned to hear Fiji named as one of the Commonwealth countries with the highest reported levels of domestic violence. In our defense, I believe these very high rates may be a reflection of growing willingness of victims to report domestic violence and a growing commitment on the part of the police and other authorities to investigate. But I still believe that domestic violence is a cause of great concerns in Fiji, and I suggest in many other countries as well. And I also believe there is a strong link between much of the domestic violence we experience in our society and the challenges we face in the field of mental health. And it is a link that goes in both directions. We know that domestic violence can often stem from abuse of alcohol and other substances, problems which our mental health services seeks to address. At the same time, we know that victims of domestic violence can often experience depression or may see suicide as the only way out of the situation. As a result, they may also need the support of mental health services. Ladies and gentlemen, I'm sure you all recall the theme of the World Health Day, which we commemorated in April this year, and with depression, let's talk about it. At the time, we were reminded that depression is the leading cause of ill health and disability worldwide, and Fiji is no exception. Despite much work that has been done to raise awareness of depression, we know that there are still too many people who do not seek help due to factors such as stigma or a lack of understanding of the condition itself. Indeed, those two factors, stigmatization and lack of understanding, are themes which echo across much mental illness. I was recently asked by a journalist what my ministry planned to do to tackle the issue of, I quote, mentally ill people living on our streets and begging, unquote. It seemed to me that the journalist in question had assumed that street people must, by definition, be mentally ill, and also that anyone with a mental illness who was not hospitalized was likely to end up begging on the streets. I'm sure those misguided views are not confined to journalists alone. Needless to say, I sought to correct the misunderstanding of what mental illness means and explained that there are many in our community whose mental illnesses are well managed and who are contributing positively to society as workers, students, parents, and carers. The fact that they can do so and no longer face the prospect of life in an institution speaks volumes for the work you do as mental health professionals, as well as the remarkable advances in our understanding of mental illness, its causes, and its treatment. Ladies and gentlemen, it would, of course, be remiss of me not to note that we recently marked World Suicide Prevention Day here in Fiji. I'm sure those of you from overseas did so well. We know that suicide is a major challenge in all our health systems. I was disturbed to learn that in 2016, there were 102 suicides and 104 attempted suicides in Fiji. These figures are a wake-up call for us to rethink our approaches to mental health and to treat it with urgency that it deserves. Last week, the Ministry of Health and Medical Services worked with our partners to promote the message of "Take a minute, change a life." We sought to emphasize the importance of reaching out to those at risk of suicide as well as those affected by suicide. We highlighted the fact that individuals who have lived through a suicide attempt often say that they wanted someone to ask if they were okay. They wanted someone to intervene, but no one did, and we cannot let that continue. Last Thursday was "Are You Okay in Australia?" Are you okay there in Australia? The day when Australians are reminded to ask family, friends, workmates, and colleagues that simple question, "Are you okay?" In April last year, we also did the same when we celebrated, and probably this is the best time for us to turn to one another and practice that. Ask, "Are you okay?" I'm sure everybody's okay in Fiji and everybody's okay in this room, but can I please ask you to turn to your colleague and ask, "Are you okay?" See, it brought a laughter on your faces. We should have started the session with this. Thank you, ladies and gentlemen. Smile, please. Right? Just be yourself. Because like I said, you also need somebody to ask you, as medical experts, as professionals, you need somebody to ask you, "Are you okay?" And many a times, we take it for granted because, I won't say me because I come from the education sector. I'll ask, because many of the times people assume that you are okay. But really, we all need somebody to ask us now and then. At least once a day, your colleague turns and says, "Are you okay?" And then if you're not okay, please be honest enough and say, "Look, this is something that's bothering me." It's very important to be open and honest rather than letting things just get to you and being all bottled up. And that's, I think, one of the biggest challenges that professionals face, whether you're in the education sector, whether you're in the medical sector, wherever you are. As a spouse, ask your wife. Expect your wife to ask you the same. As a parent, ask your children, "Are you fine? Are you okay?" Because many a times, like I said, we take it for granted that the doctor is all good, that the nurse is all good, that as parents we are all good. I mean, how would it be if your child comes and asks you one day, "Dad, are you okay?" Or "Mom, are you okay?" And then how would it be to just open up to them and say, "Look, your discipline problems are giving me a lot of stress. Your teacher's call from the school is giving me a lot of stress." It's a give and take thing. And I think we need to celebrate that not only on one particular day, but almost every day we need to ask our friends, our loved ones, our colleagues, if they're okay. So, ladies and gentlemen, perhaps we should all commit to make every day "Are you an okay day?" I acknowledge that I have focused on just a small part of many issues that make up the vital field of mental health. A glance at your program offers a clear insight into the range and diversity of the topics you'll be covering. I'm confident your discussions will be rich and rewarding experiences for you all, But I also hope that those of you who are visiting overseas will find time in your busy schedules to experience more of our beautiful country and our legendary hospitality. I commend you all for the great work that you do for those who are affected by mental illness, and I wish you all the very best for your deliberations. I'm confident that there will be much more fruitful debate in the sessions, and I look forward with great interest to learning the outcomes of your discussions. Ladies and gentlemen, before I close my deliberation and before I declare your conference open, just a word of caution. You've heard me mention about NCDs. Yes, NCDs is a rising issue for us in the Pacific, and I think across the globe. And we Fijians are well known for our hospitality and our food. So please do eat moderately and be mindful of the fact that as being in the medical profession, we need to be role models in this. So I expect all of you to enjoy, eat healthy. I don't want to say anything about drink and smoke, you are all smart in that. But please be mindful of your health, and your health is very important to us. And after the finish of your conference, I wish you all a safe journey back home to your loved ones. And thank you very much for being here.
There will be 2 points.
Is pitiful, and this is also reflected in the development assistance that rich countries give out.
Rosy Akbar for accepting our requests. Thank you very much.
Researchers and innovators from around the world have been. When I would talk about mental health as part of the global development agenda, people would laugh. Beyond treatment and care, I think it is also time for us